Got a quorum. Let's get started. We've got 11 bills we need to get through. I think this is the last meeting we're going to have before crossover. Senator Luck, you've got a couple of bills on the agenda. So if you want to come on up, I think you're the only non-committee member patron here. Well, we like you too. And we've decided to let maybe one of your bills pass. SB 34, please turn your attention to Senator Locke.
Purpose of SB 34, it proposes a limited pilot project following the opening of Riverside Health Systems first and only psychiatric emergency department in 2023. Let's see. This specially trained providers and clinicians working in the psychiatric emergency department would have the ability to perform pre-screening evaluations for temporary detention orders as a result of this legislation by reducing wait times for patients and law enforcement in crisis situations, eliminating operational redundancy, mitigating workforce shortages in the behavioral health system, and reducing pressure on traditional acute care hospital emergency departments. The intent of this patient-centric legislation is to take this new innovative facility and couple it with a new innovative pilot program that accelerates one step in the process of evaluating those in crisis who are in danger to themselves or others, need treatment, and are unwilling or incapable of voluntarily obtaining necessary treatment. And that's the purpose of this legislation.
Senator Locke, the fiscal analysis says the fiscal impact is indeterminate because it could result in admissions to state hospitals. Would you have a problem with us taking this from a 4-year pilot to a 2-year pilot? Yes. From a 4-year pilot to a 2-year pilot?
It is 2 years.
It's 2 years? Okay. And the planning district noted in the bill is 21. It's in planning district 23, right? Well, what we can make a technical change to make it 23 here. It's Planning District 21, which is not New Riverside. So
Exactly.
Planning District 23 is what we were going to try to.
But what we worked out with Legislative Services was to, since it's one facility, to, and they're working with the language on the House version as well, to do it to the Senate District, because Planning District 23 then expands to multiple locations, and this affects only one facility in Hampton. So we didn't want to drag in there's no other psychiatric ER at the moment, but we didn't want to drag in any other hospitals or healthcare systems.
So just do it in the Senate District 21?
Yes,
23.
23, Senate District 23 on for the
Okay.
2-year pilot program, which that was
And
the
not
easiest way.
Not Planning District
Not
23.
Planning District.
Okay, Senate District 23, and it
If
is
you
2
want to do it
years?
here today, that would be great. If not, we can take care of it after crossover.
Does that make sense, Mike? Do you think, Stephen?
We worked with Chandler.
And
on
it's
the House
already
side.
2 years?
It's already 2 years. Yes,
Okay.
sir. Thank you, Mr. Chairman.
Okay, motion to amend to the Senate District 23. All in favor, say aye.
Aye.
Okay, what's your pleasure with the bill? Okay. Is there a motion and a second to recommend reporting? All in favor, say aye. Aye. Any opposed? Okay. 1 for 1.
1 for 1. Okay, Senate Bill 118. This bill requires health insurers, corporations providing health care subscription contracts, and health maintenance organizations whose policy contractor plan includes coverage for obstetrical services to provide coverage for doulas, care services provided by a state-certified doula. The bill requires such coverage to include coverage for at least 8 visits during the antepartum or postpartum period and support during labor and delivery. The provisions of the bill apply to policies, contracts, or plans delivered, issued for delivery, or renewed in the Commonwealth honor after January 1st, 2025. And it also...
In the Commerce and Labor Committee, we put a reenactment clause on this.
Correct.
And we sent it to the HERC Commission.
Correct.
So does everybody understand what the bill's about? Yes. What's your pleasure? Okay. Second? Motion and a second to recommend reporting. All in favor, say aye. Aye. Okay, 2 for 2.
Pleasure doing business with you.
Thank you. Okay, Senator Bagby, you came into the room just at the right time. Senator Bagby, you've got 543, is that right?
Yes, sir.
Yes, sir.
Good morning, Mr. Chair and members of the committee. 543, the current law states that mobile crisis report response services and support and stabilization services and residential crisis stabilization units for individuals in acute mental health crisis are considered mandated benefits effective July 2021. This bill amends current law by defining behavioral health emergency services as support and stabilization services provided in a crisis receiving center to the definition, and requires the mobile crisis response, crisis receiving centers, and residential crisis stabilization units are licensed by DBHDS.
Senator, this has no fiscal impact on the state.
None.
Okay, do I?
I move to report.
Okay. Move to report, second. All in favor, say aye. Aye. Okay, thank you, Senator
Good
Bagby.
spending time with y'all. Good morning.
Okay, do we have any other non-member patrons out there? Okay, Senator Boysko, you want to do your 311?
Thank you, Mr. Chair.
And you've got a substitute, I think?
I have a substitute. Yep. Or amendments. I don't know how we're
Is there a
doing it.
substitute or are there just amendments?
I have amendments written. The amendments include creating a work group to assist with setting of the rates, adding language to require the work group to utilize design and implementation of violence prevention services benefits in other states, comparing rates to other states, including Maryland, and putting the effective date off until July 1st, 2026, so that DMAS can really work through this to set the rates.
Okay, my understanding is there's committee substitute, is that correct? Is that different from what Senator Boysko just described?
That's what I have.
Well, Mr. Chair, I think the only other discussion was, I think even Senator Boysko with her substitute, it still provides an effective date in the future, which in theory basically means the committee has to at least make sure it accounts for the fact that it's a future, it's a kind of a future bill in the drawer that it has to do. So that's, I think, the question for the subcommittee. Do you want to still keep it a future effective date or just kind of do the work group at this point?
I think we want to
The work group for this point is DMAS is supposed to design a benefit report by November 1, is that?
That's right. That's correct.
Okay, that's what we want to keep, I think.
Yeah, Mr. Chair,
Senator Fabola.
we did hear this, I think we even heard it in rules, but one of the issues was we needed to define who exactly would qualify as one of these community interventionist professionals, just like we had set up a work group to figure out who would qualify to be a doula, and they set up criteria for certification. So this is sort of a similar, a parallel track here.
Mr. Chair, eventually, when we do have it working, we'll be pulling Medicaid dollars, and there would be some matching component from the federal government. It is not determined, and I don't know what that split would be at this point. So I think maybe a work group would be a great idea to help us move this forward.
Okay, well then, are we dealing with committee substitute or with amendments? Just the amendments?
These are only amendments, that's all I have.
It's a second decision on.
Doing a substitute, incorporating those amendments into a substitute? Okay, do I have a motion on the substitute?
So moved.
Okay, and a second.
Second.
Okay, what's your pleasure with the bill then?
We're only moving forward with the work group now. My understanding is, and clarification for staff, I think it's another decision point on whether or not Medicaid will in fact cover it. Is that correct?
Mr. Chair, Senator Favola, my understanding is that Maryland and other states already have agreements with Medicaid that provide this benefit and are already doing it. So what we want this work group to do is do a study to look at how the other states are implementing it. there shouldn't be any question of whether or not Medicaid would participate in this, from what I understand.
Senator Obenschmidt.
Just so I'm clear, I mean, I'm fine with the work group, I'm fine with the concept, but we're not right now, today, obligating ourselves to go forward with the cost
That is-
before we figure out whether.
That is my understanding, so we
Okay.
probably
Right,
need,
okay.
we probably need,
Says the work group will report by November 1. We'll decide, make a decision about it next
So
January.
there is a second
so,
decision.
so it could be that we need to wordsmith what I have a little bit further, but in concept,
It'll be worked into the committee substitute.
yes, all righty.
Okay.
Thanks for the
Well,
clarification.
Now I'm going to recommend we report the bill as amended.
Great.
Okay. All in favor, say aye. Aye. Okay. We don't have any patrons out there yet. Senator Evans said he's going to be 10 or 15 minutes late. Senator Favola's got a couple of bills.
Okay.
Senate Bill 39.
Okay. Mr. Chairman, this is kinship as foster care, and what this bill does is it establishes a framework and lays out criteria for a safety plan in situations where parents cannot care for their children, at least on a temporary basis. The parents and the local Board of Social Services would enter into an agreement. There would be criteria for perhaps joint custody. There certainly would be a criteria for allowing the host family to have some authority to sign medical records or school.
My understanding
And
is there is a fiscal impact for this bill, but it's already included in the
it's in the
governor's budget.
governor's budget, and I do have language that prioritizes the funding and then just says when funds run out, funds run out.
Okay.
And this was a combination of lots of bills.
Well, the language you're talking about is not new language. It's language in the bill that's before us.
That's correct. It's language in the bill as
But
reported out.
what's your pleasure on the bill?
Move to report.
Move to report and second. Is all in favor, say aye.
Aye.
Okay. Bills recommended for report, that's 39. Senate Bill 40, you indicated, Senator Fogel, you have some changes that we're not aware of. Is that correct?
That is correct, Mr. Chairman. The bill currently directs the State Board of Social Services to amend its regulations regarding the flow of federal dollars that our foster youth would be eligible to access when they exited the system, like SSDI payments or some veterans payments if their biological parents may have died. And right now, we're hearing complaints, particularly from the Disability Law Center, that our foster youth who really are eligible for these federal payments are not getting them. And that's unfortunate because these children have no financial safety net when they exit the foster system, and they need to start a life. They need to, go on and get an education and all that. So the intent of the bill was to really ensure they had access to the federal benefits they had access to. It's a little bit more complicated than you might expect. Not every Child Protective Service agency sets up a trust account for the children in their care. There's probably some blending of dollars in here. So I'm getting a feedback that there will be a fiscal impact. So to avoid the fiscal impact, I would like to amend my bill to state that DSS shall establish a task force with stakeholders at the table to evaluate policies and procedures intended to ensure that our foster youth
So you just changed
have
the
access.
section 1 bill, you changed the section 1 bill to become a work group, section 1.
Yeah, with DSS establishing a stakeholder group and to report back to us by November 1st, 2024.
Senator Reeves.
Can we include the omnibus on that we just put in? I think that'd be very beneficial.
I agree, the children's ombudsman.
Do you have language, Senator Favola?
I can work up. I do have language in my brain, and I can sit down and I'll write it out, and we'll be happy.
Okay, does the Department of Social Services have any,
Good morning, Mr. Chair. I have not seen the language or talked to Senator Favola about the about the amendment, but it's starting, if you want to move it forward, we can work on her with the language to make sure I can administer it as you.
Well,
Or ask
and I want to figure out if it's going to have, a work group's going to have a fiscal impact.
Not, this is just a stakeholder group. DSS would convene and report back to us November 1st. We'd expect you to meet with the stakeholders and tell us what policies and procedures would need to change to ensure that trust funds were established for children eligible to receive federal benefits.
Yeah, Mr. Chair, Senator Favola, it's, as with all these work groups that are sent my way, it's a matter of managing all the work groups that everybody wants me to study. And so, Senator, to this specific issue, it may not be a fiscal impact for this issue. I have to take it into account with all the other work groups that the legislature is looking at.
Would you like to talk to me after this meeting? Okay.
We'll be happy to work with you to get the language into a place
When
that
do
we
you
can
need-
hopefully move
Can
forward.
we adopt it in concept here, and then I can provide exact language by
Okay, well,
tonight?
there's a motion and a second to adopt the substitute in concept that establishes this work group. Does everybody understand what the concept is? Okay, what's your pleasure on the substitute?
Thank you.
Okay, motion to, we've adopted the substitute, motion to recommend report. All in favor, say aye.
Aye.
Okay, any opposed? Okay, we'll report that in substitute form and concept, we've got the concept down, but we'll get the language down by the time we get to full committee. That'll be this afternoon.
That would be this afternoon, so we're
Okay.
going to have a little conversation.
Senator Carol Foy's not here, is she? Mike, do you have any idea whether she's going to be here?
Mr. Chairman, I mean, her office was notified, but I haven't heard anything, whether she was planning to come or not.
Okay, and she's got Senate Bill 140 and Senate Bill 186 from Senator Subramanian, yes.
Subramanian.
Subramanian, that's right. We don't think he's going to be here. Is that correct?
Mr. Chairman, yeah, his office indicated that he probably would not be able to make it.
Okay, the notes suggest to me that we've got some amendments to narrow the scope of his bill. Is that correct?
Mr. Chairman, yes, there was a consideration, the idea that like to kind of do a more narrow, not as an elaborate kind of look, just really look at what other states have done on these efforts, just narrowing the work group to not be as robust as it's proposed currently.
The bill, the notes I've got, it directs the Secretary of Health and Human Resources to convene a work group to evaluate the feasibility of establishing a wholesale drug importation program in the Commonwealth, considering the cost and safety of such a program. We're going to narrow it from that.
Yes, Mr. Chair. I think the idea is really just more just kind of like to look at what other states have done in this effort more and just report back as opposed to like kind of designing a whole actual program to do this.
Okay, do we have specific amendments to narrow it? Okay. Does everybody understand what the substitute, okay, is there a motion to adopt the substitute? Okay. All in favor of adopting the substitute, say aye. Okay, the narrower version of 186, what's your pleasure on that?
I will move to report the bill.
Okay, is there a second? Okay, all in favor, say aye. Aye. Any opposed? Okay, we'll recommend reporting that narrower, skinnier. Okay, it looks like we're down to the bills that I've got and one from Senator Evan, one from Senator Carol Foy. Let's just do these bills I've got and then we'll get, maybe Carol Foy or Evan will be here by the time. 274 is the prescription drug affordability bill. The one we passed last year.
Is it any different, Mr. Chairman?
It's no different from last year. I don't think. The impact is $1 million. We're going to work to narrow that down in the budget writing process.
You're going to narrow.
We're going to narrow the cost down, yes.
Well, how are we going to narrow it down? Because I'm inclined to support this. What
Okay.
will you do differently?
Well, we're just going to figure a way to reduce the cost the best we can. Well, I don't know what else to tell you. I don't know what else to tell you.
May I ask staff, what would some of the possibilities be for narrowing? Not that the chair has made a decision, but what possibilities would you have here? Would you limit the number of drugs looked at, or how would you narrow the cost?
Mr. Chair, Senator Favola, certainly, I mean, most of the costs are for staffing, so it's kind of like, you know, when you set something up like this, you'd probably phase it in over time. Certainly, just looking at like, what are the proposed costs to do this? Certainly, you could narrow it, kind of what they're looking at initially, basically just trying to kind of minimizing the workload at the beginning.
A couple of ideas how we could narrow it.
Let's get rid of it.
All
I
right,
think you'd
in
like 'em.
concept, because we're going to figure out ways to,
We're not changing the language, we're just changing the price tag.
changing
The price tag, we're not changing the language.
you know, I'm gonna use this rationale in future discussions. Okay, I guess with the trust I place in the chair and staff's ability to maybe figure out how to make this less expensive, I'm gonna move that we report the bill with amendments coming in concept.
Well, the amendments will not come to the language. The amendment will be in the cost. Okay?
It's called,
Okay,
That's
called
right.
central planning.
The language will pass.
the language, the language, this is authorizing, and you're gonna decide at what level to fund it, and at what level. All right.
We're gonna fund it. We're gonna fund it. We're gonna fund it
At what level?
at what level? That's right.
the question.
Okay, we've got a
All right, I
motion.
will move that we report the bill. of authorizing.
Okay, got a motion and a second. All in favor, say aye. Opposed?
I
No.
regret that I cannot support this.
Okay. 2 noes. 2 noes. Okay. Senator Carol Foy got here, and she's got Senate Bill 140.
Yes, good morning, Mr. Chairman, members of the committee.
Morning, Senator Carol Foy.
Good morning. Senate Bill 140 establishes the fetal and infant maternal, excuse me, establishes the fetal and infant mortality review team to develop and implement procedures to ensure that fetal and infant deaths occurring in the Commonwealth are analyzed in a systemic way. The bill requires the team to compile triannual statistical data regarding fetal and infant deaths and to make such data available to the governor, the General Assembly, and the Department of Health. The bill provides that information and records obtained or created by the team and portions of meetings of the team at which individual fetal and infant deaths are discussed shall be confidential.
Okay. The fiscal impact on this bill is $900,000 a year. So does anybody have any questions of Senator Carol Foy?
Chair, it does say at the end of the bill that the work as created shall be contingent on the ongoing funds, and the team at its discretion may alter its work to meet budgetary constraints.
I think this, Mr. Chairman,
This is an important issue, I think. I would like to see us be able to move this forward.
Mr. Chair,
Senator Reeves.
can I ask the senator, what do they do right now? How do they track and what do they do?
Yes, so there are other maternal and infant mortality review teams, but the data and CDC as well. So the CDC just collects information about, statistical data about deaths, not necessarily the cause of deaths, what attributed to it, ways to avoid it. This team will fill in the gaps of other review teams because they solely focus on infant deaths from 0 to 12 months. They will be doing geographical, analytical data. They will be interviewing the mothers and family members to determine what socioeconomic issues attributed to the death, lack of health care, lack of clean air, clean water. What is happening that is causing Virginia to be one of the worst states for maternal mortality and infant mortality?
This is an important topic. It's just a question of whether or not we can fit this in the budget.
Yeah, and I mean, we do have, and I just looked this up, Mr. Chairman.
Senator Rubenstein.
The Virginia Department of Health has the infant and child mortality surveillance system and the state child fatality review team. Does this supplement that or replace it, or how's it, or duplicate it?
It's not duplicative. What this team does is fill in the gaps that the other teams don't. And so they don't necessarily collect interviews. They don't collect the information from interviews. They don't necessarily do geographical diversity. They don't look at specifically from 0 to 12 months. Other groups and teams, what they do is they take statistical information pretty much, and that's it. But we want to have evidence-based, data-driven solutions to the problem of infant and maternal mortality. And in order to do that, we have to find out what is contributing to that. And a lot of the issues as to why infants aren't born alive happens before birth. And so a lot of those teams don't have those conversations.
Mr. Chairman, I wonder whether the cost could be reduced by maybe assigning those duties to an existing team rather than creating another one. Just curious.
Mr. Chair, I think we're all in favor of the intent of what this review team could do, but at some point we could just ask them to complete a report for a point in time, rather than having an ongoing review team, and see what happens in that point in time with recommendations. The price tag is high, and I don't think it's a good practice to pass something and just say we're going to fund it at whatever level we decide. So,
Mr. Chair.
with all due respect, I guess I'll move that we carry this over, but I would really like you to work on it for next year. And
I would like to add, if the chair could send a letter to this infant and child mortality surveillance system to look at the concept that you have and whether or not they can do some of that for us.
I would, that's a friendly amendment. I'll second that.
Okay. That is, then carry over with a letter to the Department of Health, Secretary, our infant and child mortality system.
Thank you, Mr. Chairman. Thank you, members of the committee.
What did you understand the motion?
Yes, so.
Okay,
there
all in
was-
favor of
there
that,
was a
say
second.
aye. Okay, any opposed? Okay, thank you so much.
Thank you.
Thank you.
Okay, Senator Evans here. He's got a bill, Senate Bill 676, if you're ready to go.
Thank you, Mr. Chairman. Sorry for being late. 676 directs DMAS to amend the financial eligibility standards for certain waivers providing services to individuals with developmental disabilities so that Social Security disability insurance income is disregarded by the department when calculating such individuals' financial eligibility for such waivers. Currently, disabled Virginians with a Medicaid-funded waiver to pay for group homes or community supports and services to build their independence have a monthly income limit of no more than 300% of the maximum SSI to maintain this waiver. That was, in 2022, that was $941 a month, meaning their maximum income from all sources a month was $2,823. So most waiver recipients begin their time on a waiver receiving only a personal SSI. If they're able, they can work and still earn a modest amount of income while staying well below the income cap for receiving their Medicaid, which has incredibly meaningful and impactful benefits both physically and mentally for those living with disabilities. So in 2019, CMS granted new authority to states to decide how to count SSDI income specifically for waiver users. And for so many years already, people with DD waivers have had to reduce their working hours or even quit their jobs entirely if their parents retire or pass away to keep their gross income under the waiver income cap. CMS guidance changed in the last year or so, and this is now allowable for obvious reasons. Well, I should say for this year, 2024, is the first year ever that a parent passing away can leave enough in SSDI retirement to the child so the child would immediately become ineligible for the waiver. As wages and retirement ages increase, this will become a more and more pertinent issue. And I believe Senator Favola had co-sponsored this legislation, which I appreciate. This came from parents and advocates in Northern Virginia, including one in Senator Boysko's District, who's also co-sponsored this legislation or chief co-patroned it, experiences it has a real impact on Virginians.
What we were trying to figure out, Senator Eben, with respect to this Section 1 bill, was how many people it would affect. And I think Mike has some amendments, or Stephen has some amendments to try to get DMAS to report to us on the impact of this waiver. Is that?
So, Mr. Chairman, what I'll just add is that was one of the questions, was sort of how many people are impacted. So in further discussions with DMAS, they actually think that this affects very few people. So really, I think there are two options for the subcommittee. You could let the bill proceed forward, or you could basically delay the effective date for a year and just have them kind of come back with how many people are affected. So those are kind of the two options to look at.
I would note it is very few people, as you said, but is there not a third option that we could let the bill proceed, and if we felt it was necessary and prudent to put a sunset on it, just to see if it's excessive? But I can't imagine it would be if we estimate very few people.
Senator Obenstein's got something.
So I've just read staff's notes, and I mean, I'm very supportive of this concept. We're trying this year, well, we try virtually every year to reduce or eliminate the wait list. Staff's notes indicate that to some extent, this is going to add more people and maybe impact our ability to eliminate the wait list and create a new wait list, and potentially increase the cost of these slots, of funding these slots. I wonder how we can do this without, and also eliminate the wait list. I'm just a little bit concerned about that. I want every one of these families to be covered, and I'm very sympathetic to the work concerns, and very much in favor of encouraging that that kind of work opportunity. So I'm in support of your bill, but I'm concerned about those waiver slots.
Senator Boysko.
Thank you, Mr. Chair. I thought I just heard you say that it would really affect very few people. Could we just clarify if that's what?
Well, that was the question,
Is that
Senator
our
Boysko.
understanding?
The notion of a delayed effective date or reenactment clause or something, and to have the DMAS report to us how many people it affects. Right now, they don't think it affects that many people. It's my understanding.
How many is?
Okay.
How many is not many? That's
Yeah.
right.
Well, go ahead, Mike.
Mr. Chairman, Mr. Boysko, I mean, they just indicate very few, and again, that's kind of just the question, and it could be very few. It's just that they don't have a number that they've indicated to me.
Mr. Chair, could I ask a follow-up question to Mike?
You certainly may, Senator Boysko.
Thank you. So my constituent, who was Senator Favola's constituent for the past 10 years, and I have talked a lot about this over the summer, he believes in his research that we would actually be saving the Commonwealth money because they would be then eligible for the federal funding, and this actually could end up being a positive for, and it is a very small group of people, I understand. Would you concur with that?
Mr. Chairman, Senator Boysko, I would probably have to look into that more to kind of give you my opinion, and I can certainly do that, but I don't have enough information to verify that.
Senator Favola's had her light on for a number.
And my apologies. Mr. Chairman, I am fine with the amendment that DSS actually sort of create an analysis and definitely determine how many people might be eligible and report back. Was that your amendment, Senator Eben?
Is anybody, Will?
Will's here, Will Frank.
Mr. Chair, Will Frank with DMAS. We had been working with the constituent and members of the General Assembly on this issue. I think, as Mike said, I think the actual number, we're not entirely sure right now.
Is it more than 100 or less than 100, or?
I do not know.
You can't quantify it all?
No, not right now. I don't think I could.
Mr. Chair,
Senator Boyce.
I would suggest make a motion perhaps that we amend this to become a study and then try to
Report back.
report back on.
Senator Evans got some objections to
No?
that.
Yeah, I was going to suggest that we require a report on November 1st, 2024, but further that we let it, since we believe it is very few people, let it go into effect and put a sunset of 1 or 2 years and start, and we'll certainly have real numbers then to see if it's excessive, but if we think it's very few, I don't see the harm in getting started. These young people, or some of them not so young, are already working, and for them to be cut off from their
I don't disagree. I don't lack empathy for these young people, but no matter how many waiver slots we create, we don't have the workforce to do the work for the waiver slots that are out there.
Mr. Chair, could I just, my understanding is this is actually allowing them to have their job,
To make more money.
to make their little amount of money that keeps them occupied through the day and helps them feel like they're, living their best life. It's not that they're getting services, but it's actually giving them the ability to have these jobs and still continue to get the benefits that they're already having if they don't have the job. They're already have the services. They're having to stop their jobs because they're making too much money because their parents have assets. And this would enable them to continue to have their jobs, not to receive additional services.
Senator Evans.
My suggestion would be that we ask for a report on November 1st, 2024, and allow the bill to go into effect with a sunset of either July 1st, 2025 or 6.
Second.
Okay, got a motion and a second. Senator Obenshain had his mic on.
Everything you say, I agree with. I want to encourage these opportunities, but aren't we shooting first and asking questions later by doing it this way and saying we're gonna start it? And if we find that there are more people that qualify, we wind up than we expected. We may wind up with a waiting list that's a little bit longer. We are going to save on the individuals, but we're potentially going to spend more on the program as whole because more people are eligible, which I'm fine with. I want them to receive those benefits, but it just seems like we don't know.
Mr. Chair.
Senator Boyce.
I think there's a misunderstanding. If Will could come up and clarify exactly what the problem is here, I think that would be really helpful.
Mr. Chair, Will Frank again. So basically what the issue is currently when somebody has this SSDI, they can't say no to. It puts them, if that's counted as part of their income or their assets, it puts them over the limit. And so I think this wasn't allowed. Our guidance for a while from CMS said this was not allowed. Recent guidance says it is allowed. So we would just submit a state plan amendment and we would have to amend some waivers to be able to do this. And I think the question is, it doesn't necessarily, from my understanding of the fiscal impact statement, it doesn't necessarily add to the people getting services. It would add people to the wait list of being eligible to get those waivers when those waivers were allocated.
Senator Evans, Senator Favola. Senator Favola.
Okay, thank you, Mr. Chairman. I mean, this is really a policy decision about whether we want the folks who are currently on the DD waiver, which you can narrow it to that, can be allowed to work and not have their SSDI count as the income for eligibility purposes. So it's how we want to run our program. I don't know how many people will actually be eligible, but it's not going to affect the current waiver slots in any way, and it's not going to affect our expenses in serving those individuals who would have an SSDI income disregard. It is only the potential that more people could be eligible.
So the question really is, do we go forward with it now, or and wait for the information, or do we wait for the information and then go forward with it?
I'm fine waiting for the information and then going forward, but the information is always going to be one point in time. They could report back to us November 1st, whatever we have, and they'll say, as of November 1st, 2024, these are the people eligible. Just
Sure,
like
that's always going to be the case.
It's always going to be one point in time, and I just want to be perfectly clear about that.
So it seems to me we can go forward with the amendment that's been proposed, or we can amend it and say, we ask for the report and then we reenact.
I believe we should ask for the report and reenact.
Okay. So is that an amendment to the motion?
It's an amendment to your motion.
Is that all right?
With that?
Senator Eben, do you?
Yeah, I'll go with the will of the committee.
Okay. The motion is to ask for a report by November 1st and then reenact next year. And that'll be the substitute. All in favor of that reporting, say aye. Any opposed? Okay. Then we'll report the bill that way. Senator Supermunion's not here. Well, we've narrowed his scope, so we've only got my bill left, and that's 590. We've got a substitute for 590. And what that bill was about and was essentially putting the step Virginia in the Code of Virginia. It's codifying what's been in the budget since 2017, and I think the substitute incorporates this language that ensures that it's subject to availability of funds, which means that it's not really a mandate, because we're not paying for it, unless we have to pay for it to be effective. Does that pretty much explain it, Natalie? Okay. So we've adopted, and that, it's Senate Bill 590. Well, with the substitute, have we adopted that yet? Okay, we're going to adopt it again. All in favor of the substitute, say aye.
Aye.
Okay. So with that, unless there are any other questions, do I have a motion to report? Okay. Is there a second for that? Second. Okay. All in favor, say aye. Okay, that looks like we've cleared the docket. So we're done. Now,
Sir.